workers. What's something that goes on behind the scenes that the public should be aware of? Story 1. I work in an emergency department, and there's something I wish people knew about the emotional toll this job takes. We're often seen as the calm professionals, handling critical situations with speed and efficiency. But what most people don't realize is that we, too, are humans who have to suppress our emotions to be effective. We've had patients arrive with life-threatening conditions that could be avoided if they just came in sooner. We've watched people die on our tables despite our best efforts. And in those moments, there's no one to talk to because we need to keep it together. Sometimes, after a tough day, we go to the break room, where we just sit in silence, staring at the walls. We're not allowed to grieve. We just go back to the next patient, the next crisis, the next trauma. It's a constant cycle of emotional overload, and we're always understaffed. You might be waiting in the waiting room for hours, but that's because the doctors and nurses are trying their best with the few resources available to them. People yell at us because of the wait times, but they don't understand that we're doing everything we can. A thank you, a little appreciation, can make such a huge difference for someone who is trying to save lives on minimal sleep and barely enough support. Story 2. I'm a nurse in a busy hospital, and one of the things people don't realize is just how much of our time is spent cleaning. We're constantly disinfecting everything. And it's not just the equipment, but the floors, the walls, the bathrooms. Every patient room is a potential source of infection, and we have to take extra care with everything. Sometimes we have patients who don't understand the importance of cleanliness. They'll leave their rooms in disarray or refuse to let us clean certain areas. But even the smallest mess can become a breeding ground for bacteria. And if someone in the hospital gets a healthcare-associated infection, it can be devastating. There's also this idea that doctors are the ones who are always making the big decisions. While they absolutely play a huge role, nurses are the ones who see patients the most. We notice things before the doctors do. Subtle changes in condition, signs that something's off. But we rarely get the recognition we deserve. In fact, we're often the ones who get the brunt of complaints from patients or family members. It's exhausting to give our all day in and day out, only to have our efforts go unnoticed. Story 3. I work in the kitchen at a hospital. And believe it or not, people rarely think about what goes on. A lot of people assume that hospital food is just bland and tasteless because the patients are sick. But there's more to it than that. We work around strict dietary guidelines and must ensure that every meal meets a patient's specific health needs. No salt, low sugar, low fat, gluten-free, you name it. The real kicker is the quantity. We don't just cook for a few people, we're preparing meals for hundreds. And the worst part is when we don't get any feedback. We send out hundreds of trays every day, hoping we've made something that's acceptable, but unless there's a complaint, we don't know if anyone is actually happy with their meals. We put hours of work into making sure each meal is nutritious and follows the correct restrictions, but it often feels like no one cares. We also deal with a lot of food waste. We have to throw away so much because a patient's condition can change at a moment's notice, and what they could eat yesterday, they can't eat today. Some days, I feel like we're just preparing food to throw away. Story 4. I work in the ICU, and one of the things that constantly amazes me is the level of emotional resilience we need to do this job. It's not just about keeping patients alive, it's about keeping their families hopeful, even when we know things aren't looking good. There are days when I have to break the news to families that their loved ones are unlikely to survive, and those moments are soul-crushing. People don't realize how emotionally taxing it is to be a part of someone's final moments. The ICU is where miracles happen, but it's also where many people come to say goodbye. And the burden of hope is often placed on us. Patients' families expect us to fix everything, but there are times when we know there's nothing more we can do. Those moments don't get talked about enough. What also doesn't get talked about enough is the burnout. We work long hours, often without breaks. The emotional toll can be just as draining as the physical demands. I've seen co-workers leave the field, not because they don't care, but because they simply couldn't carry the weight of it anymore. Story 5. I work as a medical social worker in a hospital. And one of the things I want people to understand is the mental and emotional exhaustion that comes with this job. We often work with patients and families during the most traumatic moments of their lives, whether it's dealing with terminal illness, trauma, or a sudden life-changing injury. One of the hardest parts is trying to support families while also dealing with the heavy bureaucracy of the hospital system. They don't understand why they can't get immediate answers or why their insurance won't cover certain treatments, and I'm the one they often take it out on. But I don't have all the answers. I'm there to help them navigate the system, connect them with the right resources, and offer emotional support, but sometimes, no matter how much I try, it's never enough. What people also don't realize is how much emotional labor this job requires. We're constantly managing our own emotions while helping others with theirs. It can be exhausting, and there are days when I feel like I'm giving more than I have to offer, but we keep going because it's our job to help those in need, even when it feels like we're barely holding it together ourselves. Story 6. I work as a radiologic technologist in a busy hospital, and one of the things that most people don't realize is how mentally demanding this job is. It's not just about taking x-rays and scans, it's about positioning patients, making them comfortable, and ensuring that the images are as clear as possible, often while they're in pain or anxious. We're often in a rush to complete procedures because we're trying to keep up with the constant flow of patients. One of the most stressful situations is when someone is in severe pain, and you need to position them in certain ways for a scan, all while trying not to cause more discomfort. We try to be gentle and considerate, but it's hard when you're up against the clock and the patient is in distress. But what's even harder is when things go wrong. There are times when we might get poor quality images, and we have to retake them. Sometimes, multiple times. The pressure of having to redo an exam, especially when it's critical for diagnosis, weighs heavily on us. We're not just there to take the pictures. We're part of the team that helps doctors make important decisions. And in those moments, you feel a mix of self-doubt and anxiety. We don't often get the chance to discuss our emotional responses to these stressful moments. We keep pushing through because we have to. One of the things people don't see is how we don't get enough time to properly rest. We might spend 12 hours a day on our feet, moving quickly from one patient to another, with no time to eat or sit down. And after a long shift, we don't just go home and relax. We take all that stress and fatigue with us. I've had days where I just want to crawl into bed, but instead, I find myself thinking about the patients I saw, wondering if I did everything right. Story 7. As a surgical technician, I assist in the operating room every day, and while it's often a fascinating and fast-paced environment, there's a side of it that no one talks about. The reality is, we don't just handle scalpels and instruments. We're often the emotional backbone of the surgical team. We're there to ensure everything runs smooth, but we're also the ones who are constantly managing the underlying anxiety and tension in the room. There are times when a surgeon will be under extreme stress due to complications during a surgery, and that tension gets passed on to the rest of us. In those moments, it's not just about technical skill, it's about keeping a cool head and making sure the team stays focused. We also have to pay attention to minute details, making sure that the right tools are ready, that the patient is positioned correctly, and that all equipment is functioning properly. But what most people don't realize is that, after the surgery, we're the ones who are left to clean and prepare the room for the next operation, all while dealing with the emotional exhaustion of having just been part of something that can be both life-saving and traumatic. It's easy for people to assume that surgeries go smoothly, but there's always the possibility of complications, and those moments can take a toll on us. It can be hard when patients don't fully understand how much we're doing behind the scenes. After a surgery, they thank the surgeons and nurses, but they rarely acknowledge the role of the surgical techs. We're often the unsung heroes of the operating room, working tirelessly to ensure the team has everything they need, both physically and emotionally. Story 8. I've worked as a hospital janitor for years, and it's one of the most overlooked and underappreciated jobs in healthcare. People walk through the hospital every day without thinking twice about the cleanliness of the place. But behind the scenes, we're constantly working to ensure that everything is sanitized and safe. And when it comes to hospital cleanliness, it's not just about mopping floors and emptying trash cans. It's about preventing the spread of infections. In the ICU, for example, we have to be extra cautious. One tiny mistake, leaving a surface unsanitized or failing to properly clean a room after a patient leaves, could lead to deadly consequences. We don't just clean floors, we wipe down every surface, every piece of equipment, every doorknob, all while making sure we follow strict infection control procedures. We have to be fast but thorough, especially during flu season or when dealing with contagious diseases. What people don't realize is the emotional toll this job can take. We see patients in their most vulnerable states. Sometimes, we're the ones who clean up after surgeries or traumatic events. We're the ones who have to prepare rooms for new patients, often without the time or space to process what we've just seen. The job is physically demanding, but the emotional weight of it can be even harder. It's not just cleaning. It's being a silent witness to the stories that unfold in the hospital, day after day. And while we're working hard to keep everything clean and safe, we rarely get any recognition. I've had patients stop and thank the doctors, nurses, and other staff, but I've never been thanked for keeping the place hygienic. It's a thankless job, but it's also one of the most important, especially in a hospital where health and safety are top priorities. Story 9. As an emergency room clerk, my job is to triage patients when they come in. And it's honestly one of the most intense and underappreciated roles in healthcare. Most people think of ER workers as the doctors and nurses, but we're the ones who make sure patients are processed quickly and efficiently when they first arrive. The reality is, every single day we deal with people who are in extreme distress, whether it's a medical emergency, an emotional crisis, or something else entirely. One thing that people don't realize is just how difficult it can be to maintain composure when you're faced with people who are panicked, angry, or scared. You'd think that people would understand the ER is chaotic, but we're often the first point of contact, and when things aren't moving quickly enough, we're the ones who get yelled at. We try to stay calm, but it's emotionally exhausting to deal with that constant negativity, especially when we're doing everything we can to get patients seen as quickly as possible. Additionally, we're constantly juggling multiple tasks at once, checking in patients, entering their information into the system, confirming insurance details, and communicating with doctors and nurses. The pressure is immense, and the sense of urgency never stops. People assume we're just sitting at the desk, but we're running around, answering phones, sorting out paperwork, and doing everything we can to make sure the ER keeps functioning smoothly. And then there are the situations where people come in with non-emergency issues and expect to be treated immediately. That's always a tough conversation because we understand their frustration, but we have to let them know that their situation doesn't warrant immediate care. It's a delicate balance, and we're always trying to stay professional, even when it feels like the entire world is against us. Story 10. I'm a pharmacist at a busy hospital, and one thing that most people don't realize about our job is how much responsibility we have to ensure the correct medications are administered at the right time. People think that pharmacists just hand out prescriptions, but we're involved in the entire process. We collaborate with doctors and nurses to make sure that the medications prescribed are the right ones for the patient's condition, and we double-check everything before it's given to the patient. There are times when we catch potential errors that could have serious consequences, and it's often up to us to intervene. The pressure is intense because one mistake can result in harm to a patient, and when you're responsible for hundreds of prescriptions a day, it can be overwhelming. We don't get a lot of recognition for these behind-the-scenes actions, but the weight of it is always on our shoulders. What's also challenging is the amount of work that goes into managing inventory and ensuring that medications are available when they're needed. With constant shortages of certain drugs, we're often scrambling to find alternatives, all while managing the expectations of doctors and nurses who rely on us to make quick decisions. But the hardest part of this job is the emotional side. We're often the ones to break bad news to patients when they can't get their prescriptions filled due to shortages or insurance issues. It's not just about the medication, it's about the impact on their health and well-being. And while we do our best to provide the best care, there are times when we feel like we're not enough. But we keep going because the patients need us. Story 11. I'm a hospital case manager, and while the public often focuses on doctors, nurses, and other frontline staff, we're the ones quietly working behind the scenes to ensure that patients get the care they need after they leave the hospital. The job sounds simple enough. We coordinate discharge plans, assist with home health care, and ensure that patients have the resources to continue their recovery at home. But in reality, it's a much more complex and emotional task than most people realize. One of the hardest parts of my job is dealing with patients who don't have the necessary support systems in place. When I meet with patients, I often discover that they don't have a family member to help them or don't have the financial resources to afford things like medications or home health visits. It's heartbreaking to know that people who need the most support are the ones who can't access it. Even harder is when we can't find a solution. Sometimes, after spending hours on the phone trying to arrange for at-home care, we're met with dead ends. Insurance companies won't approve necessary services, and community resources are stretched too thin to accommodate everyone. It feels like a constant struggle just to make sure these patients are set up for success when they leave the hospital, and I often go home at night wondering if I did enough to truly help them. Despite the emotional toll, we're often invisible to patients. They thank their doctors and nurses but rarely recognize that the person who helped them with the discharge process is a key part of their recovery. Still, it's incredibly rewarding when we do make a difference, when we connect someone with the help they need, even if it's just a small step forward in their healing journey. Story 12. I'm a hospital chap, and while it's not something most people think of when they consider healthcare workers, our role is incredibly important. We provide spiritual and emotional support to patients and their families during the most difficult times in their lives. People often assume that we're just there to pray for the dying or offer religious advice. But our work is much broader than that. When a family member is on life support or when a patient is facing a terminal diagnosis, we are there to offer comfort, listen to their fears, and help them navigate the complex emotions that come with these situations. We aren't there to impose any particular belief system, but rather to be a source of compassion and empathy for those who are struggling. Often, our role is to sit in silence with someone, offering a quiet presence that can speak louder than words. But one of the hardest parts of the job is dealing with the emotional exhaustion. The emotional weight of this job is immense. And there are days when I feel completely drained. When a patient dies, it's not just the family who grieves. It's also the chaplain who has walked with them through their final days, sharing in their sorrow. Sometimes the hardest moments are when we're asked to help a family make life or death decisions, or when we're asked to provide comfort when the inevitable end is clear. And despite the emotionally taxing nature of the work, chaplains are often overlooked. People may thank the doctors, nurses, and even the cleaning staff, but we're rarely acknowledged for the role we play in providing emotional and spiritual support. Still, we continue because we believe our work makes a difference, even if it's hard to measure or quantify. Story 13. I'm a hospital transport worker, and every day I move patients around the hospital from one department to another. We're the ones who push gurneys, wheelchairs, and even take people down for critical tests or surgeries. At first glance, our job might seem simple. We just push a cart from one place to another, but there's a lot more that goes into it than most people realize. One of the most difficult aspects of our work is the sheer volume of patients we move. We're constantly moving from one patient to the next, making sure they're comfortable, secure, and ready for whatever comes next. And when things go wrong, like when a patient suddenly starts deteriorating or has a medical emergency while being transported, it's on us to remain calm and take quick action. But it's not just the patients we deal with. We also interact with families, and sometimes that's the hardest part. Families are often anxious, upset, or frustrated, and we have to be the calm, reassuring presence in the middle of all that emotion. We're the ones who make sure patients are safely transported to where they need to go, but we're also the ones who witness their most vulnerable moments. What people don't realize is how physically demanding the job is. We don't get breaks, and we're always on the move. After hours of pushing heavy carts and assisting patients, it can be exhausting, and yet we're often overlooked. People don't thank us for our efforts, but we know that our work is just as important as any other role in the hospital. Story 14. I'm a hospital pharmacist, and one of the biggest challenges I face is managing the pressure of ensuring that the right medications are given to the right patients at the right time. It's not just about filling prescriptions. It's about being an integral part of the healthcare team and helping doctors and nurses make the best choices for their patients. But there's a lot more that goes on behind the scenes than people realize. One of the things that many people don't think about is the complexity of medication management in a hospital setting. We often have to deal with patients who have multiple health conditions and are on numerous medications. Our job is to make sure that all of those medications interact safely and don't cause adverse reactions. It's an incredibly delicate balance, and we have to be on top of everything at all times. But what's even more difficult is the constant pressure to catch errors. Medication errors are one of the leading causes of harm in hospitals, and it's up to us to prevent them. Every day, we're double-checking orders, ensuring that dosages are correct, and verifying that the right medications are being prescribed. The stress is high and the responsibility weighs heavily on us. Yet we rarely get the recognition we deserve. People thank the doctors and nurses, but they often forget about the pharmacists who help ensure that everything goes smooth. We also face the challenge of medication shortages, which have become more common in recent years. There are times when a doctor will prescribe a medication that's no longer available, and we have to scramble to find an alternative. These situations are stressful because we know that the patient's well-being depends on us making the right choice. Story 15. I'm a medical interpreter, and I spend my days helping patients who don't speak English navigate the healthcare system. It's a job that requires not just language skills, but a deep understanding of medical terminology, cultural sensitivity, and the ability to stay calm in high-pressure situations. While many people think of interpreters as simply translating what's being said, the role goes far beyond that. One of the most difficult aspects of being a medical interpreter is dealing with the emotional strain of interpreting during life-altering moments. I've been the one to translate when a patient receives a cancer diagnosis, or when a family has to make the decision to take a loved one off life support. It's an incredibly challenging position to be in because, while I'm helping the patient understand what's happening, I'm also the bridge between them and the healthcare providers. The weight of those moments is enormous. It's also a job that requires constant mental focus. When I'm interpreting, I have to listen carefully, translate accurately, and make sure I'm conveying not just the words but the tone and meaning of what's being said. There's no room for mistakes, especially when it comes to medical terms or critical information. And yet, Despite the responsibility and the emotional burden, we rarely get the recognition we deserve. We're often the unsung heroes in the healthcare system, helping people who are already scared or confused navigate a system that isn't built for them. Our role is vital but often invisible. We are the ones who ensure that language barriers don't stand in the way of care. And while we're not saving lives in the traditional sense, we're helping ensure that every patient gets the information and care they deserve. Story 16. I work as a hospital security officer, and while most people may see us as just the ones keeping the building safe, there's so much more to our role. We're the first line of defense when something goes wrong, whether it's a violent patient, a potential thief, or a family member causing a scene. But there's another side to our job that people rarely consider. We're also the ones who help families navigate their emotional turmoil during some of the worst moments of their lives. I can't count the number of times I've had to intervene when family members lash out at doctors or nurses because they're scared or upset about a loved one's condition. It's emotionally draining to be caught in the middle of that, to calm them down and remind them that the healthcare team is doing their best. But what people don't realize is that sometimes it's not just the patient that's in need of care, it's the family. And when we intervene, we're not just managing a security risk, we're de-escalating a highly charged emotional situation. In addition, we spend long hours walking the halls, checking exits, monitoring security cameras, and making sure that everything is safe. But a lot of the work is behind the scenes, preventing theft, responding to alarms, and dealing with people who think they can bypass the system. We're trained to stay calm and focused, but sometimes it feels like no one notices all the work that goes into making sure a hospital runs smoothly. It's stressful, and there are days when I wonder if anyone appreciates that we're more than just the guys in the uniforms. We're an integral part of the hospital team, trying to make the hospital environment as safe as possible for both patients and staff. Story 17. I'm a surgical assistant, and while I enjoy my work, it can often be much more mentally and physically taxing than most people would think. When someone thinks about surgery, they picture the surgeon in the spotlight, performing the procedure. But there's an entire team behind the scenes making sure everything goes according to plan, and we're a big part of that team. A lot of what we do is the grunt, preparing the patient, ensuring sterile equipment is available, organizing surgical tools, and keeping everything running smoothly during the operation. It's incredibly detailed and requires constant attention. But the stress really kicks in when something goes wrong. Whether it's a complication or something unexpected happens during the surgery, the pressure on everyone in the room rises immediately. And while the surgeon is working their magic, we're the ones anticipating ready to pass them tools, ready to assist, ready to think 5 steps ahead. The hardest part? Not getting recognized for the work we do. When the surgery is a success, everyone applauds the surgeon, and the nursing staff gets a thank you for caring for the patient. But we're often invisible, even though we're just as crucial to the success of the procedure. It's a hard pill to swallow, but we keep doing it because we know we're an essential part of the process. We're not just holding tools, we're holding the success of the patient's surgery in our hands. Story 18. I'm a hospital respiratory therapist, and one thing I wish people knew is how stressful our job can be, especially during peak flu seasons or times of respiratory illness outbreaks. While many people think about respiratory therapy in terms of just giving oxygen or ventilators, our role is much more complex than that. We work with patients who are struggling to breathe, sometimes in life or death situations, and every second counts. One of the hardest parts of my job is when a patient's condition deteriorates rapidly. We have to act quickly, adjusting machines, administering medication, and constantly reassessing the situation to make sure they're getting enough oxygen. The pressure is immense because if we make even a small mistake, the consequences can be catastrophic. But what makes it harder is that sometimes, despite our best efforts, the patient doesn't improve. I've had patients code on me, and there's a feeling of helplessness when you know there's nothing more you can do but watch as the doctors and nurses fight for their life. What most people don't see, though, is the toll this takes on us emotionally. The loss of a patient hits us harder than people realize. We get so attached to our patients, especially those who are in the hospital for extended periods of time. The emotional roller coaster of celebrating progress and then facing a setback is exhausting, but we do it because we care. But it's rare that people recognize the mental strain we're under. Respiratory therapists are often the quiet workers in the background, managing life support systems. And though we're the ones who are often directly responsible for stabilizing patients, we don't always hear a thank you. Story 19. I'm a hospital laboratory technician, and while many people think that our role is just about running tests and giving results, there's a lot more to it than that. We're the ones who work behind the scenes to make sure the doctors have the information they need to make accurate diagnoses. If a doctor is to determine the right treatment plan, we provide the data that helps them do that. and we have to be incredibly precise. One thing that's often overlooked is the immense pressure we're under to deliver quick results without sacrificing accuracy. We can't afford mistakes, especially when it comes to critical tests like blood cultures or biopsies. When a test result comes back indicating something severe, like cancer or a dangerous infection, it can be emotionally draining because we know how much it's going to impact the patient's life. And when we get a positive result, it's not just about sending out the report, it's about making sure the doctor understands the urgency. On top of that, we have to keep up with the never-ending stream of tests, and it can be overwhelming at times. I've been in situations where a doctor needed a test result urgently, and I had to work with an abnormal machine or a backlog of samples. It feels like we're constantly fighting against the clock, yet we rarely get the recognition we deserve. The doctors and nurses are often thanked by the patients, but it's the lab techs who make sure that every diagnosis is backed by the most accurate and timely information. Story 20. I'm a hospital admissions clerk, and while my job may seem simple to outsiders, there's an emotional complexity to it that people rarely think about. Most of the time, I'm the first person patients and families interact with when they come to the hospital, and sometimes that's the hardest part of the day. We deal with everything from gathering personal information to processing insurance details, but it's not always straightforward. I've had patients come in with severe injuries or family members who are distraught over a loved one's condition, and we have to remain calm and organized while they're dealing with the stress of the situation. But beyond the paperwork and formalities, there's a human element. People are often in pain, anxious, or scared, and as the first face they see, we have to offer reassurance, even when we're just trying to get them into the system. One of the toughest parts is when a patient is admitted without insurance. There's a lot of back and forth trying to figure out payment options, and many times we're faced with the heartbreaking reality that some people simply can't afford the care they need. Watching them leave, knowing they might not get the treatment they require, is a burden I carry with. But what's even harder is when people don't understand the system and think we have the power to change their situation. I'm there to help them navigate a complicated system, but I often feel like I'm being blamed for circumstances beyond my control. Despite the emotional exhaustion and the difficulty of the job, it's rewarding when we can make the process easier for someone in distress. It may not seem like much, but sometimes just offering a kind word or a smile in the middle of a crisis is the most important part of our job. It's hard work and it's easy to go unnoticed, but without us, the hospital wouldn't run smoothly. Story 21. I work as a patient advocate in a hospital, and while I love helping people, it's one of the most emotionally draining jobs you can imagine. My job is to be the liaison between the patients and the healthcare system, which often involves navigating insurance issues, making sure patients understand their treatment plans, and addressing complaints or concerns from patients and families. One of the hardest parts of my job is dealing with the bureaucracy of the healthcare system. The number of phone calls I make, the piles of paperwork I go through, and the constant back and forth with insurance companies can make it feel like I'm not doing anything meaningful. Sometimes I'll spend hours just trying to get approval for a patient's treatment, and in the meantime, their health is deteriorating. On top of that, patients often don't understand why things take so long. They get frustrated when they have to wait for treatments or procedures to be approved, and I'm the one who gets to break the news. I always try to empathize with them, but it's hard when you're stuck in a system that moves at a glacial pace. When someone's health is on the line, waiting for approvals can be agonizing for everyone involved. The most emotionally taxing part of the job is the patients who don't have the resources to navigate the system themselves. I've seen families struggle to pay for medications, find housing while their loved ones are in long-term care, or access follow-up care. Watching people break down because they don't have the means to access what they need is heartbreaking. We try our best to get them the resources they need, but sometimes there's not much we can do. It's moments like that that remind me how much we take our healthcare system for granted and how often it fails the people who need it most. Story 22. I'm a hospital housekeeping supervisor, and while most people think that cleaning the hospital is a straightforward task, there's a lot more to it than just mopping floors and changing linens. Our team plays a critical role in ensuring the hospital remains safe and sanitary, which is especially important in a medical setting where infections can spread rapidly. We're the ones cleaning up after surgeries, sanitizing the waiting rooms, and ensuring that every room is sterile for new patients. What people don't realize is how physically demanding the job is. We spend long hours on our feet, moving from one area to another, disinfecting high-touch surfaces, cleaning patient rooms, and more. It's not just about making things look clean. We have to make sure that we're preventing the spread of harmful bacteria and viruses. During flu season or when there are outbreaks, we're especially vigilant, making sure we don't leave anything uncleaned. But what's even harder is when people don't appreciate what we do. Most patients are too focused on their own health or their family members to even notice the work. It's rare that someone stops and says, "Thank you for ensuring that the hospital stays clean and safe for everyone." It's a thankless job in many ways, but we continue doing it because we know how important it is to keep the hospital environment sterile. The emotional toll of the job comes when we deal with the more personal side of cleaning. I've cleaned rooms where patients have passed away, and that's always a difficult moment. It's not just about cleaning up the space. It's about recognizing the life that once occupied it. But we have to carry on. It's an emotionally complex job, one that most people never stop to think about, but without us, the hospital couldn't function. Story 23. I'm an emergency room triage nurse, and let me tell you, it's a chaotic job that most people wouldn't even begin to understand. The moment someone walks into the ER, we're already assessing them, prioritizing who gets seen first, and trying to make split-second decisions about their care. It's not just about making sure people are comfortable, it's about determining who is most at risk and needs immediate attention. One of the hardest parts of my job is dealing with the people who walk in with minor injuries or complaints but think they're in a life-threatening situation. Sometimes people come in with a runny nose, a sprained ankle, or a mild fever, and we still have to treat them with urgency. It's frustrating because, on the other side of the room, we have someone who's having a heart attack, someone with severe injuries from a car accident, or someone who is about to go into labor. These patients with minor issues take up valuable time and space, and it's hard to balance everything, especially when the hospital is at full capacity. But the most emotionally exhausting part is the patients who don't make it. We do everything we can, but there are cases where, despite all our efforts, a person doesn't survive. Watching a family's heartbreak, hearing their pleas, and trying to give them some comfort during such a tragic time is incredibly draining. You learn to compartmentalize those moments, but it never gets easy. What people don't see is the toll it takes on the staff. We're working long shifts, making critical decisions, handling emotionally charged situations, and constantly on our feet. And yet people rarely thank the triage nurses. Most of the time, we're just the background noise while other healthcare workers take the spotlight. But without us, the ER wouldn't run smoothly. Story 24. I'm a hospital social worker, and one of the most challenging aspects of my job is managing patients' emotional needs while also navigating the logistical challenges of healthcare. We're often the ones who help patients and their families understand complex diagnoses, help them make decisions about their care, and provide emotional support through some of the most trying moments of their lives. One thing people don't realize is how many families don't have the support systems they need. It's heartbreaking to see someone who is facing a major health crisis without a family member to lean on. It's even harder when we're tasked with helping families make difficult decisions, like whether to continue life-sustaining treatment for a loved one or transition to hospice care. Those conversations are emotionally exhausting because you can never really prepare for the weight of. We also deal with the logistical side of things. In addition to providing emotional support, we also assist with things like securing insurance approval, finding resources for follow-up care, or connecting patients with support groups. But navigating insurance companies, finding affordable care, and dealing with all the red tape that comes with healthcare can be an incredibly frustrating process. More often than not, I'm helping families who don't know where to turn or how to get the care they need. While people often thank doctors and nurses for their care, social workers often go unnoticed. We're the ones who help make sure patients' needs are met after they leave the hospital, and though it's rewarding to make a difference, it's emotionally taxing. We carry the weight of families' struggles, and while we offer support, we also take on some of their burden. It's a job that requires compassion, patience, and a lot of resilience. Story 25. I'm a hospital dietitian, and while people generally recognize the importance of nutrition, they don't always realize just how much effort goes into creating a meal plan for a patient. It's not just about providing food that tastes good. It's about ensuring that every patient gets the right nutrition based on their medical condition, allergies, and dietary restrictions. One of the biggest challenges we face is dealing with patients who don't want to follow the meal plan. Some patients refuse to eat what we recommend because it's bland or doesn't align with what they're used to. But as much as we want to make sure they're comfortable, we have to remind them that the food we're giving them is helping them heal. It's hard to strike a balance between providing nutritious food and respecting patients' preferences, but it's something we're constantly navigating. What people don't understand is the amount of behind-the-scenes work it takes to create an individualized meal plan for each patient. For patients with diabetes, heart disease, or kidney failure, every meal has to be carefully calculated to provide the right balance of nutrients. We have to collaborate with doctors and nurses to make sure everything aligns with the patient's medical needs. And when something goes wrong, like a patient having a reaction to a food item, It falls on us to find a solution and make sure they're okay. We also deal with food shortages, where we may not have the ingredients needed for certain meals or where substitutions need to be made. It's stressful because we want to make sure every patient gets what they need to recover, and sometimes that means coming up with creative alternatives on the spot. It's a rewarding job, but it's easy for people to overlook just how much work goes into creating the meals that help patients heal. We're not just feeding, we're helping them recover, and that's something I'm proud of. But it's not always easy, and we rarely get thanked for the work we put in behind the scenes. Story 26. I'm an emergency room nurse, and one of the hardest things about my job is the unpredictability. No two shifts are the same, and you never know what you're walking into when you clock in. One minute, you might be dealing with a routine patient who has a minor injury, and the next, you're facing a massive trauma case. The ER is chaotic, and while I've learned to keep calm under pressure, it doesn't make the emotional strain any easier. A lot of people don't realize the level of multitasking involved. We're constantly balancing several patients at once, trying to assess who needs urgent care, who can wait, and who might be in critical condition. This isn't a job where you have the luxury of taking your time. You have to make decisions on the fly with little to no information, and there's no room for error. The hardest part, though, is when you can't save someone. I've held a person's hand as they took their last breath, and those moments stay with you. It's especially difficult when the patient is young, or when there's a family in the waiting room waiting for good news, unaware of what's happening. You try to comfort the family, but the pain is overwhelming for everyone involved. The worst part? No one really acknowledges the emotional toll it takes on us. Everyone thanks the doctors, but the nurses are often invisible in that equation, even though we're the ones doing a lot of the hands-on work, especially in critical moments. But even with the difficulty and exhaustion, I wouldn't trade it for anything. The satisfaction of helping someone in pain or saving a life, even if just for one more day, makes it all worth it. It's a job that requires a lot of heart, but it also takes a lot out of you emotionally, and that's something that doesn't get talked about in Story 27. I work in a hospital pharmacy, and one of the biggest challenges in my day is the constant rush and pressure. Patients need their medications on time, doctors are constantly calling with new orders, and we have to make sure we're catching any potential issues with the prescriptions. There's so much to juggle at once, and while we work as a team to make sure everything is done correctly, the pressure can be suffocating. What most people don't realize is how much thought and care goes into making sure the right drug is dispensed to the right person. It's not just about putting a pill in a bottle. We have to review each prescription, check for interactions, confirm the dosage, and ensure that there are no contraindications. A single mistake can be life-threatening. It's incredibly stressful to know that we're responsible for such a significant part of the patient's care. On top of that, we're constantly faced with medication shortages. Some drugs are in short supply, and we have to scramble to find alternatives that will still be effective for the patient. It's a lot of problem solving and making sure that the patient's treatment plan isn't compromised. And then, when we finally get the medication prepared, we send it off. And we rarely hear any feedback about how it worked or if the patient had any issues. There's no pat on the back for us, just the next prescription waiting to be filled. What's hardest, though, is when we know that patients are in desperate need of certain medications, but insurance or financial constraints prevent them from getting it. You try to work with patients and their families to find a solution, but sometimes there just isn't. It's an emotional burden to know that we're powerless in those situations, even though we're the ones who could be providing the treatment they need. Story 28. I'm a physical therapist working in a rehabilitation hospital, and the emotional roller coaster of helping patients recover can be both rewarding and exhausting. The most difficult part of the job is seeing patients struggle, especially when their injuries or conditions will affect them for the rest of their lives. We work with people who have lost mobility, who've been through surgeries or accidents, or who are fighting diseases that will eventually disable them. The progress can be slow, and sometimes the results aren't what we hope. One of the most challenging aspects is dealing with patients who are in denial about their condition. They often come in full of hope, convinced they'll make a full recovery, and when they realize that some things just won't be the same again, the emotional impact is profound. As a therapist, I need to be honest about their progress, but I also need to support them emotionally as they come to terms with the reality of their situation. It can be incredibly difficult to balance optimism and realism, and it's exhausting to watch patients feel defeated, knowing that they're doing everything they can, but that the results are beyond their control. We also have to get creative to keep them motivated. Some days, it feels like we're not making any progress at all, and you start wondering if the patient will ever regain what they lost. And yet, when you see that one small step forward, When a patient moves their leg for the first time in weeks or takes their first independent step, it makes every bit of frustration worth it. But it's not all victories. There are plenty of days where we don't see the breakthroughs we hope for, and that takes a toll. We get emotionally attached to our patients, and when things don't go as planned, it's hard not to feel like we've failed them. It's a job that requires constant empathy, resilience, and patience, and it's emotionally draining. But the moments when you see progress, even if it's just a small victory, make it all worthwhile. Story 29. I'm a hospital environmental services worker, and while most people see me as just the person who cleans the hospital, the truth is, my job is about much more than that. It's about maintaining an environment that keeps patients, visitors, and staff safe, especially from infections. Hospitals are full of germs and bacteria, and my job is to make sure that every surface, every room, every piece of equipment is sanitized and safe for the next patient or staff member. One of the hardest parts of my job is the sheer volume of work. We don't just clean the rooms after patients leave. We clean the hallways, the bathrooms, the waiting areas, and all the high-touch areas like door handles and elevator buttons. We have to make sure that everything is disinfected properly to prevent the spread of germs, and we don't have the luxury of time. It's an endless cycle, cleaning one room, then moving on to the next, never really getting a moment to rest. But the most emotionally difficult part of the job is when you see a patient's room after they've passed away. You have to clean the space, but it's hard not to think about the person who was once there. The room may look sterile and empty, but you know there was once a life in that bed. It's not something you can talk about, but it lingers in your mind. And despite all the hard work and emotional strain, we're often overlooked. People thank the nurses, doctors, and even the kitchen staff, but rarely do we hear a thank you for ensuring that the hospital stays clean and safe. It's a thankless job in many ways, but we keep doing it because we know that without us, the hospital wouldn't function. We may not be in the spotlight, but we're an essential part of the team, keeping the hospital environment as safe and sterile as possible.